Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by quickly assessing whether the bulging is sudden or gradual because the cause and urgency differ. Check vision and pain. Document changes with photos to show your clinician. While waiting, apply a cool compress for 10-15 minutes to reduce swelling and avoid rubbing. Make sure to use sterile saline for any discharge and remove contact lenses. Once done, call your primary care or eye specialist and prepare a concise timeline of symptoms for faster diagnosis. Once evaluated, follow the clinician's plan. Imaging and blood tests clarify causes like thyroid eye disease or infection, and intraocular pressure is measured to rule out glaucoma. If prescribed, use topical lubricants hourly for exposure and apply antibiotics or short steroid courses exactly as directed. Do not self-adjust doses. Make sure to sleep with head elevated and protect the eye with glasses or a shield. Continuously monitor symptoms and keep a log of changes to report at follow-up appointments. If conservative measures fail, discuss surgical options like orbital decompression or eyelid surgery to restore function and appearance. The specialist will explain risks and recovery. Once surgery or long-term therapy begins, incorporate eyelid taping at night and prescribed exercises to improve blinking and lubrication. Make sure to adhere to follow-up and medication schedules. Troubleshoot immediately. If vision worsens, pain intensifies, or fever develops, return to the emergency department. Those signs indicate urgent complications.
Thanks for watching. Consider subscribing if we helped you.